Acne can affect adults as well as teens. The important thing to know about acne is that there are some alternative treatments that many people will not discuss with you. Typically, people will be placed on oral antibiotics or Accutane, but there are other alternatives. A good skincare regimen can often be beneficial in the treatment of acne. Things like good skincare products without lots of chemicals, proper facials, and exfoliation can also be beneficial. There's also a laser called the isolase laser that can go into the pore, zap it shut, and close it off to prevent future recurrences. This is Dr. DePasquale. Thanks for watching. As we get older, our eyesight tends to decrease and our hearing tends to diminish. The funny thing is that most people don't have a problem wearing glasses when they can't see, but somehow they really have a problem wearing a hearing aid when they can't hear. The biggest issue, they say, is because it makes them look and seem old. But what they don't realize is that asking people to repeat themselves, I'm sorry, I didn't hear you, can also make you sound a little older. I understand that people don't want to wear hearing aids because in the past the hearing aids used to be very large and very unsightly. This is what they used to look like. They were large, they weren't that attractive. But these days the hearing aid technology has improved so much that the hearing aids are so small that you can barely see them. As I've been talking to you right now, I've had a hearing aid in my ear the whole time, and my guess is that you notice my glasses much more than you notice my hearing aid. This is Dr. DePasquale. Thanks for watching. Do you have Afrin bottles stashed everywhere in your house? Are you afraid to leave the house without your Afrin? If this is the case, you suffer from a condition called rhinitis medicamentosa. This condition causes rebound congestion in your nose. So what happens is once you use the Afrin, you can breathe freely, everything's great, and then after several hours, the rebound congestion starts in. This is a serious condition because you just won't be able to breathe without the Afrin, and Afrin has damaging effects to the inside of your nose. If you suffer from this problem, you need to see an ENT physician so that the underlying reason that you started to use the Afrin for can be identified and treated, so you can live your life Afrin-free. This is Dr. DePasquale. Thanks for watching. How do you know if you have a cold or a sinus infection? The difference lies in the duration of the symptoms as well as the severity of the symptoms. A common cold will usually last a few days to a week. Typically, you're getting better each day and you're feeling a little bit better with antihistamines and nasal sprays and Sudafed. A sinus infection, on the other hand, typically you feel worse with every day and the symptoms will last longer, anywhere from 10 days or longer. A sinus infection will usually require antibiotics. If you can't tell the difference between the two, it's important to visit your doctor so that you can have proper treatment. This is Dr. DePasquale. Thanks for watching. If you've ever had dizziness or vertigo, you know that it can be often debilitating. If you've had this problem, you've often seen a doctor that's prescribed medication for you, and then they tell you that your diagnosis is vertigo. Well, it'll be important for you to know that vertigo is a symptom and not a diagnosis. When you have vertigo, it can be caused by inner ear issues, it can be caused by issues in the brain, and it's really important to determine which of those issues is causing your dizziness. If you see an ear, nose, and throat physician, they'll perform a proper exam, including a physical exam to elicit where the dizziness may be originating, an audiogram to test your hearing, and sometimes also a VNG, which will test the function of the inner ear. Again, if you have vertigo or dizziness, it's important to identify the cause of that and not just be treated with medication for your symptoms. This is Dr. DePasquale. Thanks for watching. As we get older, many of us are looking for a way to just feel a little more refreshed and look a little well-rested. But unfortunately, so many of us have seen too many celebrities in the media that have had way too much done, and they wind up looking unnatural. What this does is it makes us afraid to have anything done. At Avanti Medical Spa, our goal is to have you look natural but be glamorous with little to no downtime. Thank you for watching. This is Dr. DePasquale. As we approach our mid to late 30s, many of us will start to see some lines creeping up on our forehead, between our eyebrows, and also around the eye area, the crow's feet area. We don't like those lines because those lines make us feel older, make us look angry, make us look sad. The lines are easy to get rid of with the products such as Botox, Xeomin, or Dysport. But so many of us are afraid to have these injections done because they feel like they might make you look frozen. The reality of the situation is that Botox or any of the related products will not make you look frozen as long as you have the appropriate dose put in. That's something most people don't know. Typically, when a patient comes into my office, I'll start with a very light dose to address the problem, because my theory is you can always add more if you need to, but you can't take it out. This way, you can leave feeling comfortable and looking natural. This is Dr. DePasquale. Thanks for watching. Tinnitus is an abnormal noise or ringing in the ear that affects 1 in 5 people in the United States. The first question that patients ask me when they have tinnitus is it curable? Unfortunately, in most cases, it's not curable, but that doesn't mean that we can't find something to make the situation more comfortable for you. These days, there is technology available to improve your tinnitus and assist with a hearing loss if there is one present. This is Dr. DePasquale. Thanks for watching. Do you suffer from sinus pressure, headaches, thick postnasal drip, or nasal congestion? Have you seen a doctor that told you that there was nothing that can be done? Well, think again. Sometimes when looking closely at CT scans, we can identify narrowing of the sinus openings. If that's the case, a simple procedure called a balloon sinuplasty may be able to help you. The procedure utilizes a small balloon which is inserted into the sinus opening and is then dilated. That procedure may help you feeling better again without the symptoms of pressure, congestion, or postnasal drip. This is Dr. DePasquale. Thanks for watching. As an ENT physician, I encounter earwax on a regular basis, and one of the things people hate the most is earwax. But surprisingly, earwax is very necessary. It actually functions to lubricate the ear canal and also collect debris that could go into your ear canal. Many people are so disheartened by earwax, they don't know what to do about it, they don't know how to clean it out of their ears, and often they go to extreme methods to get earwax out of the ears, like ear candling. I'm here to tell you today that the ear is a self-cleaning mechanism, so most of the time you don't really have to clean your ears. If you do have a wax buildup, there are some safe ways to get rid of the wax in your ear canal. First, a Q-tip can be used, but you have to really make sure that you don't insert it too far into the ear canal where you're actually pushing the wax further in. You can also use a combination of hydrogen peroxide and water, and that will soften the wax and allow it to extrude from the ear canal slowly. The other thing that one can do is obviously visit an ear, nose, and throat physician, and we can remove the wax in the office. The things that I do not recommend is ear candling. The idea of just putting a candle with fire near your ear, near your hair, is just not a very safe idea. And most people try to do that to avoid going to see a physician, but I think it's a lot safer if you go ahead and go to your local physician and get the earwax removed. Most of us don't realize that our vocal cords and our voice is really important until it doesn't work the way that it should. Hoarseness is a very common disorder that affects so many of us, and many of us don't realize that if hoarseness is persistent for greater than 2 weeks, we really have to go to an ENT specialist to see what the cause of the hoarseness might be. It's important to know that our vocal cords vibrate at over 1,000 hertz per second, so many voice disorders and voice pathology is missed on a regular scope because it doesn't allow for the vocal cords to be slowed down so that the ENT physician can identify the cause of the hoarseness. Most people also think that hoarseness is only caused by vocal cord nodules, and it's important to know that there are many other causes of hoarseness, like aging, incomplete vocal cord closure, vocal cord paralysis, cysts, and other etiologies. If you have hoarseness that's been persistent for over 2 weeks, make sure you see an ENT physician. One of the most common complaints women have is lines around the lip area. Nobody likes lines around the lip area because what happens is that your lipstick starts to bleed into those lines and it just makes you look older. These lines can be easily addressed. If they're in the early stages, a little bit of Botox or Xeomin or Dysport can be injected into those areas to just relax the line. Obviously, as things get a little more severe, there are fillers that we can use to inject into those lines to give you a nice, natural, rejuvenated look. Sometimes if the wrinkling is severe, you may need a combination of procedures such as a laser treatment in addition to fillers. Whatever the case is, the most important thing is to always keep your lips hydrated before and after procedures so that you get the best results. If you have lip lines that you're concerned about, please don't hesitate to call us. This is Dr. DePasquale. Thanks for watching. They say the eyes are the windows to the soul, but often our eyes are what give away our age the quickest. As we get older, the thin skin underneath the eye starts to develop some crepiness, dark circles, and also you can develop crow's feet around the lateral edge of your eye. The first step to start with would be a good eye cream. Eye creams should have ingredients such as retinol, haloxyl for the dark circles, or even vitamin K. If that's not enough and you've really developed a lot of volume loss underneath your eye, filler can be injected under the muscle to restore your youthful, natural appearance. This is Dr. DePasquale. Thanks for watching. People often ask me how to stay young and age gracefully. Here are a few tips for you. Number 1, avoid sun exposure as much as possible. The harmful rays of the sun will certainly age you a lot faster than if you use sun protection and a nice wide brimmed hat. Number 2, don't smoke. Smoking ages you significantly. If you compare people that don't smoke to those that do, they look on the average of 10 to 15 years older. Diet and exercise are also extremely important in staying young appearing and looking healthy. Exercise stimulates blood flow, and obviously your diet impacts your skin from the inside out. This is Dr. DePasquale. Thanks for watching. I see sinus patients on a regular basis in my office. The first line of treatment for these patients is medical therapy, but when medical therapy has been ineffective, surgery must be considered as an option. It's often very interesting to me how many misconceptions people have about sinus surgery. Almost everybody knows somebody who has had sinus surgery and they bring their horror stories with them. These days, sinus surgery isn't what it was 20, 30, 40 years ago. The technology is advanced, we have better scopes, we have image-guided systems, we have better techniques available than what we used to have. People think sinus surgery will result in black eyes and excessive bleeding, and that's just not the case anymore. These things obviously can happen, but they're just not as common as people think they are. This is Dr. DePasquale. Thanks for watching.
Why you should use a cleanser. Now, as you mature in age, you will accumulate dead skin, so it's very important that you use exfoliation. Active ingredients such as alpha and beta acids is very good to use to take out the impurities out your skin. Now, skin types such as dry, normal, oily, or combination skins is what you need to know to pick the good cleanser. You don't know your skin type? Come see me at Avanti and I will use the Visia Skin Analysis to determine your skin type and give you the best recommendation for a cleanser.